Deciding on having surgery is critical. One can anticipate that surgery itself will create a scenario of recovery. So there's pain, swelling, inflammation associated with surgery, and that needs to be taken into consideration. There are several things that you may not be able to do after surgery, and planning for those things pre-operatively in anticipation of those things post-operatively can achieve an optimal outcome. For example, if your arm is in a sling, you may not be able to drive. If your mobility is compromised, you may not be able to get in and out of bed easily. You may not be able to get to the shops. So preparing for those things in terms of having the social supports around you, having your home set up in a meaningful way that you can achieve all of your activities of daily living is critical to achieving an optimal outcome perioperatively. Once you've taken all of those things into consideration, it's really important to postpone your surgery to a time that you can optimally achieve all those things. For example, having a discussion with your employer about when the best time to take time off work, especially in the scenario where you're considering taking 6 to 8 weeks off of work, is really important to avoid disappointment from both your employer and from your co-workers. Also considering when you may or may not have family commitments, i.e. looking after children or loved ones, and or having the supports around you to be able to help you during that difficult time when you may not be able to do all of your activities of daily living for yourself.